Crisis care. The first 72 hours, critical needs and critical care. Covenant House's crisis shelters are short-term programs where a homeless child's most pressing, urgent needs are met immediately. There is no requirement that a young person be referred to them through an official channel. They can come at any time, day or night. Within the first critical minutes of a child's intake to Covenant House, a counselor will provide the most basic necessities: emergency medical care, a hot meal, a shower, and beyond. During the intake process, the kids share their stories with trained staff so they can identify their immediate needs and then plan the best way to support them. Food. Each child receives 3 warm meals and evening snacks every day. Shelter. A standard crisis shelter room includes minimal furniture, bunk beds, and secured storage in a shared bathroom. Covenant House's bedrooms give kids safe space for sleeping, grooming, and storing their belongings, but are not a hangout space. Instead, they have communal spaces throughout the building specifically there to build community, encourage healthy relationships, and inspire kids to pursue new opportunities. Their kids also have access to a closet full of clothes to help them land a job, celebrate a graduation, or be prepared for the elements outside. A cafeteria and gym, lounges, and laundry rooms are also included in their list of communal spaces, making their facilities more of a home than a homeless shelter. Medical care. Most crisis shelters have federally qualified health clinics on site to provide immediate care. At Covenant House, their goal is that within 72 hours of homeless kids' intake appointment, they're seen in the medical clinic for a full physical. There's 4 things that happen at the first medical appointment. They help young people access their health insurance or enroll in one of the Affordable Care Act plans if they don't have any. They take a family medical history and a personal medical history, gathering as much information as possible. Typical labs are ordered to ensure that kids are screened for both chronic and acute issues. A follow-up appointment is also scheduled for the following week when lab results have been received and evaluated so that treatment can begin for any diagnosis issues. Mental health. A large percentage of homeless kids who come to the Covenant House struggle with serious mental health problems. That's why the initial medical visit is so crucial. It allows them to give young people both the physical and psychiatric care they urgently need, as well as assesses if a child may benefit from one of their unique health programs going forward. They also have a mental health department organized as part of the Covenant House residential services. The psychiatrists see patients on a planned schedule on referral from the medical clinic or from the residential social workers. They also respond to crises or urgent needs identified on the floors. Legal assistance. If a child needs legal aid during the intake process, Covenant House's staff lawyer is immediately available to provide assistance, whether it's getting a restraining order or identifying change to protect against predators or handling unresolved legal issues that may prevent a kid from becoming a successful employed adult. Family homelessness. Close to half of all young women and 18% of young men who are experiencing homelessness report being a parent. The next steps after intake. The average length of stay at the crisis shelters is under 30 days, but every timeline is different. Every child can leave Covenant House and come back voluntarily as many times as they need. They know that many kids need more than one chance to achieve a future free from homelessness, and that is exactly what they provide. For the children who choose to stay with their program, they develop individual case plans tailored to their specific needs so they can begin the next steps in the continuum of care.